Did you know that when caught and treated early, prostate cancer has a cure rate of over 90%? 1 in 8 men in the United States will be diagnosed with prostate cancer this year, and each and every one of them will need to make a very personal and individualized decision about treatment options and diet and lifestyle changes. Most importantly, each and every one of them will have to find a strong, knowledgeable team of physicians, nurses, and other healthcare providers to help guide him through the process at each step of the way. So listen up, guys. This is a special edition of Healthy Connections. I'm Annetta Wilson, your host. Healthy Connections is a show dedicated to exploring a wide variety of topics, from prenatal care to Alzheimer's disease. And we do so with a wide variety of perspectives, from the professionals that help treat the syndromes to everyday people like you and me who may have personal experience dealing with these topics on a first-hand basis. Stay tuned for Healthy Connections. Joining us is Dr. Jay Amin, a urologist with Orlando Health Medical Group Urology. Dr. Amin specializes in the diagnosis and treatment of urological conditions, and he's here to discuss an important and often under-discussed topic, prostate cancer. Thanks for joining us, Dr. Amin.
Thank you for having me.
So let's talk about what a urologist does.
Of course. A urologist is a doctor who specializes in primarily the urinary tract. This is both in men, women, and children.
Prostate cancer. We know with all cancers you should get screened. And the good news is it's 90% curable. If that's the case, why are men still dying?
I think when it comes to prostate cancer being one of the most common cancers in men, it happens to do with the fact that often prostate cancer has been diagnosed too late. So the emphasis when it comes to managing prostate cancer is diagnosing early and preventative care.
The diagnosis, we hear about the digital rectal exam. Is that something that men go, nope, not going there? What other methods other than that, or in addition to that, have we advanced to the point where that's not the big scary thing for some men?
100%. I think that's the most common fear when it comes to men being screened for prostate cancer. The traditional test that we use is a PSA. It's a simple blood test that we check on a yearly or every other year basis with our routine blood work. A PSA is just a protein that we find in the blood. It's made by the prostate. And when the levels are abnormal, it kind of keys us that there might be something abnormal going on with our prostate gland. A rectal exam, which we had been doing historically, was one of the ways we could feel a prostate to see if there was a cancerous growth on it. Mm-hmm. That was all we had to diagnose prostate cancer traditionally. Nowadays, we have MRIs, which are very effective at being able to identify growths that are very small within a prostate before they're even, feelable.
Okay.
There's also urinary tests, additional blood tests, all of which are used in our tool set of identifying prostate cancer in a very early stage.
So you're taking away the fear factor because there's so many other options. What else might stop a man from coming in and getting checked? Because you said the death rate happens because people wait too late. Well, how early and what stops people?
Of course. So when it comes to screening, when it comes to prostate cancer screening, at least in this country, there's a variety of different regimens done by different organizations. Historically, if we were to standardize it, we should be screening men between the ages of 50 to 70. men who are of African American or Caribbean descent from Africa have a higher risk of
Why is
developing. It has to do with genetics.
Okay.
Certain cancers have higher predisposition in certain ethnic groups, and unfortunately, prostate cancer is more common in these groups.
So when we start having that conversation, you know what men are thinking and their partners. Is this going to be the end of my sexual function? Do I have to write that part of my life off? How do you address that?
And that's one of the key parts of having that discussion with your urologist, because fortunately, we have so many new and novel treatments that allow us to treat or watch prostate cancer without having these significant impacts. Historically, we used to just remove a whole prostate or radiate the whole prostate. These therapies still exist, and they are still excellent therapies when it comes to controlling or getting rid of cancer. But oftentimes, if we identify this disease very early in a very small stage, we can treat just part of a prostate and not have to have these significant impacts on a man's sexual health.
I know that's good news for a lot of men.
Of course.
How young is too young to start the screening process?
So I think if you have multiple family members who have history of prostate cancer, it can be as simple as just getting a PSA blood test at the age of 40. If you're African American or you have one or two family members, then you should start around age 45. And as soon as you hit 50, I think everyone should have a PSA blood test done.
How often should men get checked? Is this like a mammogram once a year? How often?
So I think the consensus is a little bit up in the air right now, but historically it's been once a year or every other year.
Okay. What are you most excited about in terms of the new treatments, what you're learning about the disease? What excites you as a urologist?
I think one of the things that is particularly exciting as a urologist is, even though prostate cancer is one of the most common cancers that we deal with in men, it's one of the lowest when it comes to mortality rate or death rate. And that has to do with the amount of research being done in combating this disease. Back in the 90s to now, 30 years later, the mortality rate, the death rate of prostate cancer has decreased by 50%.
That's huge.
It's huge. And there are now therapies where I can just treat prostate and have zero impact on sexual function and zero impact on leakage, bladder control, which has also been probably one of the greatest fear of men when it comes to hearing and treating prostate cancer.
And with all of this and all the education and the new ways of treating prostate cancer, there are still men who are dying. What would you say to someone who's still kind of like this, not going to do it?
100%. I think when it comes to prostate cancer and dying, if we can identify these patients who are at risk because they have these genetic risk factors or they have something that's very small and growing, we can watch it for a very long period of time. This is called active surveillance. It's knowing patients who are going to have prostate cancer with a risk for progression and watching this disease for as long as possible.
Because you're saying this, so this is a very slow-growing cancer.
Of course.
Okay.
Majority of prostate cancer is very slow-growing, and you can watch this disease for sometimes 5-10 years, and that's 5-10 years of good quality of life without any of the impacts that you could get from some of the treatments.
Is there ever a point at which a man is too old to worry about this?
Correct. So the historical thought process has been we shouldn't really screen men when the expected survival is going to be less than 10 years. Because it being a slow-growing disease, what's the purpose of kind of identifying this and then undergoing treatment that's going to have a significant impact on quality of life? However, if you are of good health, then you should be screened for longer. So it has to do with health as well as age.
What frustrates you the most? I've asked you what excited you the most, but what frustrates you the most?
I think one of the things that's frustrating is men who have had a poor prior experience when it comes to prostate cancer screening, be it a rectal exam, be it a biopsy that was done and it was very painful or uncomfortable or they bled and then they never wanted to be screened at again. Yes, the biopsy may have been negative at that time, but that doesn't mean that they're not going to or have the risk of prostate cancer in the future.
And with the new modalities, it's a lot less traumatic.
Of course.
Thank you, Dr. Amin, for being here and shedding some light
Thank you.
on this topic. We will be back. Stay with us. Prostate cancer is one of the most curable cancers affecting people. But if you don't take care of your health, you won't be here to make healthy connections. And that is what we want for you more than anything. I'm Annetta Wilson. Thanks for joining us.